Now he gets
Yeah, I can see you. Just half of your body's in it.
Wow, end of the week. Anyway, gives me great pleasure to introduce Holly, who's obviously had a lot of experience with different hospitals, and she's here to share some of those experiences.
Yeah. I did a talk earlier this year, didn't I? The same, was it
Last year.
last year, the same sort of thing, and I spoke a lot about hospital, my experience in hospital, which is actually on YouTube if you want to see it, and it's quite informative, I think. And when I went to think about doing that again this time, I kind of just got a bit bored, so I thought I wouldn't do that, but there's a lot of really good insights there, and Jan was just telling me out in the hallway that she's actually changed some of her practice from some of the things I'd said. So sorry I'm not redoing that speech, but I'm not. But it's out there.
Yeah.
It's out there.
How do we find it on YouTube?
Well, I just googled Holly Ralph.
Did you want to just quickly encapsulate what those pointers were?
I think I will give a brief history of kind of my life and some of the challenges with CF. I talked about hospital. I talked about a few do's and don'ts which I'd found that had come up for me throughout all my years of hospitalisation. And one of my big do's was, please don't be so scared of sputum. There's still a lot of health professionals that are, looking and grimacing, and see, I can see grimaces already just by the discussion.
You just have to say the word.
But you see, that's a real problem because we with CF, we know it's gross. We're farting and shitting and coughing at work while we're having sex our whole life, and it's embarrassing. So to have that back, for us to see that on your faces while we're probably our most vulnerable in hospital, it would be so good if you guys could preferably overcome it, and yet if not, because everyone has their own peculiarities and that's life, repress it really well. Yeah, I'd say that. I would ask for that. Something else I also talked about was being really meticulous to detail. I'm allied health myself, and I understand how it's very easy not to tick one box or to miss a line in a note. I understand that. But things have these big knock-on consequences. For example I gave last time, I was talking about a drug I was allergic to that I have to take, but I have Panadol to manage bad fevers I get. And someone hadn't written down what dose I had for Panadol, and thus I wasn't able to have any more. And that just caused such huge pain for me. Or a test, if I'm not told to fast, when I should have been told, means I miss 3 days of work instead of 2. So those little tiny details, which don't seem like much, actually end up having quite big effects. Yeah, I talked about that. I talked about hand washing. I talked about how we all know that hand washing does transmit infection, and with CF we're taught a lot about cross-infection. Like, it's really drunk into us. It's part of our story of CF is how to prevent infection. So I was talking about how it's hard as a patient to be questioning professionals and their abilities by saying, have you washed your hands? Which of course is our right, but it's really, really hard. You feel rude, you might get your workers offside, like it's not a cool thing. So what I was suggesting was, if you guys actually wash your hands in front of us, then we as patients don't have to ask you. We know the select few people we do have to ask because they haven't done it, but it also uses, you guys get to use the patient as your bottom line of safety. You know how you talk about, what is it? It's right person, right route, right time and all that, and you actually get to involve us. It's really important, I think. And that makes us feel a lot safer. Yeah, was that kind of it? Oh, I was talking about infuser ports. Have you all seen infuser ports? I was just talking about just treating them really, really well, like only having people very trained in using them, because we have to live with them, and the consequences of them going wrong is huge. Because if we're in for an exacerbation and then, for example, something went wrong and we had to have it removed and put back in, or our lung function was already compromised, it's like a really big deal. Same with our PICC lines, CVCs, please just treat it. Because you you see so many and you can, just get all worked out about them, but us as patients, they're still like really precious to us. So please just, treat them like gold, I think I said. Is that about it?
Well, there's things that impact on that.
Oh, yeah.
Well, as I
Yeah.
try to do.
Yeah. Okay. So today's talk. So I'm Holly. I'm 40. And so by the stats, I'm actually pretty much past my use-by date, really. Average life expectancy, I think, in the developed world is about 37 and a half, 38 now. So that's actually where I'm at. So I'm at the end stage, really, planning for lung transplant at the moment. So by the stats, I'm actually average and normal, which is quite horrifying to me. Don't want to be average or normal. I'm going to talk to you today briefly about a few key areas of my life, namely work and study and sex, and hopefully contribute to your awareness of living with CF, and hopefully start a lot of conversations. I'm then happy to open up to questions. I think these forums are brilliant, and feel free to ask me anything, like really anything. If I feel uncomfortable or I don't know the answer, I'll simply tell you that I don't want to answer that or I can't answer that. But really, please use me. Just ask whatever you want. So I'm a social worker by trade. I coordinate a mental health program, and I work in an agency that's really supportive to me and my health needs. They know I've got CF. Well, they do now know. I didn't actually tell them before I got my job, but I alluded to it into the interview. When I was asked about my experience of working within the health system, I said, combined with my experience and my education, I had lived experience of working in the health sector. So I kind of tried to sell it as an asset, and I guess I got away with it because I got the job. It's always a really hard decision whether to tell or not to tell in the workplace, because disclosure can have quite clear costs. Like you may not get the job or you may not maintain your job. But the benefits as well might be that you're actually entitled to is that the workplace is structured a bit differently and a bit flexibly for you. So I've done both. At this stage of my illness, I can't really hide it. I can't say I've got the flu every day, and cough. Like I have to be basically pretty upfront. You're always trying to minimise stigma and discrimination. I mean, that's part of the reason why you wouldn't disclose. I'm really glad to be back at work again. I didn't work for a year in 2012-13 because I had this sudden deterioration in my health, where I had a rapid 20% drop in lung function following a really bad flu, which I've never picked that 27% back up. So I went from having 3 times a year going to hospital for 14 days, into that year I went 6 times between 14 and 30-day stays. So I just couldn't maintain my job at that time at all. And it was really hard. It was the first time, apart from being so sick, that we actually started to talk about lung transplants. And I struggled with a lot of the psychosocial stuff going on around that. The loss of identity and structure around not being able to work and not contributing to society. I struggled with a profound sense of failure that I hadn't been able to maintain my health. I had this sense that it was more in my control, but I felt I should have been able to maintain it. It's very difficult sometimes not to internalise society's message. Messages that you are in control of your health, or that being sick or having a disability is lesser. But as much as you can cognitively fight that, there's still all those internalised messages that's going on. At that time, I was so unwell. My family of origin couldn't really cope with it. My fiance from the time, who I left, which is good, weren't able to cope with my health changes at all and really quite withdrew. My daughter was 16 at the time, and because I was in hospital so much, my ability to care for her was really compromised. So it was really, I'd say, the hardest time of my life. However, over time, like a year, my health did stabilise and I've adjusted mostly, mentally and physically, to my lowered lung function, so it hasn't gone back up, but I've learned how to cope with it better. So at the moment, I've been working 3 days a week, which actually is probably just a little bit too much for me, because on those 3 days a week I do work, I still have to do 6 naps a day, 2 sessions of airway clearance a day, an hour of exercise a day, and eat all that food I need to eat all day. And I can't. I don't adhere to my regime, maybe 75% on those days. So that's three days out of the 7 where I'm not, completing my regime, which is nearly 50% of the week, and that's actually really not, I'm not happy with that. So just last week I've stepped down to 2 days a week work, and that's sad. Like, I'm really sad about that. And living with CF, you're constantly dealing with that sort of loss and that grief. These things you're giving up all the time, like goals and dreams and abilities. Not having the physical ability or the time to reach my professional goals and intellectual capacity is really frustrating. It's almost like I have to always pitch to my lowest. For example, at work, with my workload, if I see some new things I want to implement, I have to always be aware that the next month I might be in hospital. So I can only have my workload how I could scrape by while I'm still sick, so I'm always pitching low. And that sucks. Probably sucks for my employers too, but anyway. What is good about my new job is that the whole floor, bottom floor is doctors and nurses. So when I am having an exacerbation, I'm doing IV antibiotics, I actually can go into one of the nurses' rooms and they're nice clean white beds and do all my IV ABs there. Usually in the past, I've been hiding in work car parks, in the car, with a coat hanger with my drip bag in my car, shooting up my drugs for the ones that I can just do like that, hang up my other ones, terrified that someone's going to come from work and see me in the car. Or I'm doing it in the toilets at work, scared that someone's going to wonder why I've been in there for 20 minutes, and then look in the bin and find alcohol wipes or water for injection. It's just going to look so dodgy. So it's really quite amazing for me to be working in an environment where I can be so upfront. 80% upfront. Yeah. Working in mental health has really sharpened my attention to the correlation between chronic illness and mental health challenges, especially the links with anxiety and trauma, depression. I really don't think we get this quite right yet with CF treatment. I think it's still too overlooked, and we really need to step up to working harder to maintain the mental health and well-being of people in the CF community. Absolutely. I've also just started studying externally, doing a Masters of Sexology, which is fabulous, so interesting. Really passionate about human rights-based approach to sexuality and disability. There's just so many taboos in that one sentence, it's fabulous. There's still pervasive and damaging myths regarding people with chronic illness and sex, such as people with disability or chronic illness are neither sexual or desirable, can't really have sex, don't really need sex education, and have much more important things to worry about than sex. Despite having a child at 22 and going through the hospitals, I think I would have had less than 5 talks about sex or contraception or reproduction or sexuality or even relationships with any of my CF team. And yet the literature conclusively shows we're struggling with poor body esteem, we're struggling with not feeling attractive and physical difficulties and barriers in our sex lives. So things we might be experiencing or we fear we're going to experience are difficulties with sexual positioning, chronic bloating in our stomachs, impaired fertility, chronic thrush, fatigue, hemoptysis, breathlessness, stress incontinence and pelvic floor weakening from all our coughing, erectile dysfunction and loss of libido. There's a lot going on. I really think the CF team and all the healthcare professionals like you guys involved with us really need to recognise the important part that sexuality and relationships play in just being human, and how much sexual health and well-being can add to your overall sense of health. We're obviously struggling, so we need you guys to have these conversations with us. Like, no matter how tricky or awkward or embarrassing it is, we really need you. At the moment, my long-term plan with studying is to do a national qualitative study on how people with CF are maintaining their sexual identity and sexuality and relationships during their very long and frequent stays in hospital. Because we are maintaining it while we're in hospital. We're actually having sex in your hospitals, guys. Maybe in your bathrooms or car parks or the chapel. That was cool. embarrassing. We're on our phones or on our computers. And on that note, I actually want to say thanks to CFWA for rolling out free Wi-Fi so we can do all our chatting and internet dating while we're in hospital. Internet dating sites don't know you're there with an IV bag and oxygen prongs or astronomy tubes. They think you're on a beach in a bikini. So thank you for the internet. It's helping us be less lonely in hospital. I chose to go back to school and study, partly to set me up for the future when I'm not well enough to work, so that pre-transplant and post-transplant time to give me something positive and fun and to look forward to the future. It's a really good example of how all my decisions have to be underpinned by CF at all times and shaped, all done. I just want to finish off by saying thank you. Thank you for all your skill and your care and your love, because we wouldn't be here without you. And that's it.
The most important question, do you have a man?
No. No, and I think definitely I was engaged during that time that I was ill, and I think his inability to step up and be part of that was led to me ultimately leaving, which also helped my health really, but definitely relationships affected by CF. When do I tell people? How much can I expect them to be involved? It's a real thing.
Because that's really funny, because this week I asked, what happens? Because I said, obviously, people with CF would understand each other a whole lot better and understand everything that goes with it.
Yeah.
And then they said, no, they can't be together because, obviously,
Because of
increasing risk. And
then
they just kind of went, brushed like, as if like, yeah, no, that's all, we don't, they where's the relationships? How does that all work? I was like, how do they have physical relationships? And it was just kind of like, and anyway, lunch. Like there was no actual, nobody really answered, like you say, it sounds like it is a big gap in there.
Yeah.
They've covered everything else, but...
So a lot of people with CF are married and are having relationships, but it absolutely does bring challenges, especially as, married, so a CF person who knows they're going to have a shortened lifespan, there might be difficulties with kids. People are going into relationships often wanting to spend their life with someone and have children. So there is that stuff and that internalised stuff, not being good as a normal person. There's all that stuff that goes on. So it is hard. There is people with CF who've hooked up with other people with CF, and there's some beautiful benefits of that, of people sharing experiences together, absolutely. And back in the days before cross-infection policy, it was not uncommon. You guys have more access, I suppose, to the broader CF community than I. You guys can probably talk to that as well.
Yeah, I mean, there's certainly some couples, and there's been, some really dastardly effects from relationships as well.
Yeah.
But it works really well for some people too. I know there's a famous couple in our community that both had transplants. And they do really well together. And
I've interestingly, just in the last few months, I think also since I've started sexology and I've been writing a lot of assignments on disability, exposure starts making you mind. I'm finding I'm attracted to the guy with one arm or the guy with I'm actually...
It's quite inspirational.
Yeah, it's just, I'm going like, I don't want to be with a healthy person really, which is a whole different way of thinking usually. I'm kind of enjoying those thoughts. Yeah.
I have a question.
Yeah.
You said you've got your daughter is 16.
18 now.
How has she coped with your illness as she's grown up, and you having to explain to her that you're unwell all the time?
Well, she has learned, how you just, when you live with something, it's just what you understand as your normal? Her name's River. So, for example, when she was little, before she could talk, she used to cough at everyone because she thought that was normal, like just coughing. She's actually quite a remarkable young woman and is quite a practical, no-nonsense person. So she's accepted, quite an advocate for CF in a way, and quite an advocate for making people wash their hands and telling people off if they come to the home with a cold. I think she's doesn't so much grieve, I guess, as well, because mostly I've been well most of her life. But she does, what was I going to say, she doesn't grieve. I think she's quite future focused. Like if like a recent conversation we had, I was like, you know, River, I don't have to have a transplant. There is other ways of thinking about it. Like, everyone dies and this is the end of my life and I don't have to have a transplant and I can just move towards death. And she was like, oh my God, Mum, is that what you'd say to people at your work? So I was like, she's like, if they have cancer, would you say, don't have chemo, it's your time to go? I was like, no. See, and you know, or if I've gone to see the transplant team and I'm like, oh yeah, your lung function's a bit down, it's getting closer. She's like, good, get it on, get it over with, come on. She's really quite practical. So, yeah.
Is she quite defensive with you? Like if people are around, does she really defend you?
A little bit. Yeah, I just saw her do something recently with another family member who doesn't really know enough about CF. She had a go at them and they should know more. That's coming with age, you know. She's pretty feisty.
Yeah.
Dad, definitely dad.
Well, you said that one of the most difficult things is telling people about your condition and seeing how they respond. How do most people respond when you...
I don't remember saying that at all, but I'm totally happy to answer your question. Maybe I was talking about in the workplace.
Yeah, sorry, in the workplace you said, yeah.
So you're asking about the workplace?
Yeah,
or?
specifically at
Yeah, in the workplace. Well, people are constrained, aren't they, by politeness and role. So I say it in a way, I might build up to it, like cough, oh, because, you know, everyone always goes, have you got a cough, have you got a cold? And I might, in 1 week, go, oh, no, it's not catchy, don't worry, it's just a genetic thing, I've got bad breeding, or some joke. And then I'll say, oh, I've got a chronic illness. And then if they keep asking, I might tell them I've got CF, but I usually... And some people don't get it. There's always one colleague who'll every day go, still got that cough. And I'm like, oh. Yeah, so,
Have you found your workplaces supportive, as in the employer?
they are supportive, but they've got to have a balance because, I mean, they need the work to be done, and if you're off sick, someone else has to carry your work. So it's, what I used to find is that I used to last in jobs about a year because first hospital stay, everyone's really supportive. Second hospital stay, everyone's less supportive. And the third hospital stay, I'm embarrassed and I'm pretending I'm not in hospital. So I've had, what works best if I work part-time and then I can just change my days around a bit more. So generally people try, and people are not really able to discriminate on the basis of illness. They can discriminate around the edges of it. So you're allowed to be sick, but you can't be late for work, you know? So there's ways. Yeah, it's tricky.
How did you cope with dealing with an infant when you had
And had an infant?
Yeah.
I think as an infant.
No, when you had your daughter, how did you cope with your treatment?
I was really well. Like I was only 22. I made a choice to have her really young when I felt I was really healthy.
So you chose to have it, like
Yeah,
you planned
yep,
it, like
she's
you
planned,
told
yep.
everything. Yep.
So I planned to be young, so I'd have as much of my life as I possibly could with her and while I was really healthy. I had help. I had someone come in 3 times a week for 3 hours just to do things like housework and stuff. I was really into attachment parenting. Do you remember? I think we talk about that a lot now. But so she was kind of always with me. So I was often doing really sporty things with her, and I just tried to stay well like that. But it was exhausting. Like there's no way. The thought of doing it now would be horrific. But I guess I just stopped most things. I was really committed to parenting, and I felt very lucky to be able to have one kid. I felt very blessed, and it's just right. I also had this sense I wouldn't do it again, so I didn't want to miss a minute. So it was just kind of all about setting my schedule to River's. As soon as she slept, I'd sleep. Eating really well, trying to maintain a healthy lifestyle as possible. I breastfed for 2 years. That's what worked for me. That's how I should sleep there and just latch on, and I would just sleep for the whole night. That was pretty cool. Stuff like that. So putting my health first. But ultimately, it's challenging because your baby's needs come before yours, and that could be a problem.
How did you find pregnancy?
Easy. It's really young and fit, and I was just doing hours of yoga every day. Pretty healthy. Yeah, I found it easy.
What was your job back then?
I was a circus teacher. Aerobatics and stuff. So it was all just moving.
So you could sort of,
Yeah.
keep that side.
Yeah,
That was
keep
sort of part of your...
Yeah, that's right. And I did that for another
Exercise, so
10 years after she was born. Worked on different community arts projects, teaching and circular trampolining and trapeze and sporty stuff.
What sports have you done or exercise?
At the moment, I'm really into rock climbing. That's my big thing. I was always big on yoga. I used to do a lot of water sports, but I've actually found that's too... It's quite sad. I tried to go snorkeling a few months ago, and that's beyond me now. That sense of getting puffed with the weight of the water on my chest and coughing phlegm in a snorkel was like a horrible sight. Yeah, no, so I'm just... that's something I've had to cut out. A lot of water sports. As a kid, I got onto trampolining, which was really good for me, which paved my way into circus, really. That was through actually the CF camps. When they sent like the State Trampolining Association down to our camps. Yeah, sport, I'd be pushing sport to everyone.
Do they do genetic testing when, children are in the CF?
Do you mean for like the genotype? I mean, they do the
Yeah.
Guthrie's Hill
Yeah.
test.
Yeah.
Um,
To find out, whether
well, I don't know, because I haven't had a kid with CFC. Does anyone here have a kid with CF that remembers? I don't know.
Are you talking while you're pregnant? Is there testing for while you're pregnant, or
Do you
No,
mean
no,
after you've been
checking
diagnosed?
to see whether the child
Is a carrier
Yeah.
or
Yeah.
a...
Or
But if you've actually got CF and you have a child, you're guaranteed to have a carrier because you pass it because they've got the two
Yeah,
bad
yeah.
genes, and you're going to
Yeah.
constantly pass one bad gene
Yeah.
off anyway.
Yeah.
Is that what you?
Yeah.
Does that answer?
Yeah.
Yeah, so she's a carrier. Yeah.
I guess now because with all the new drugs that are coming out, there's a lot more emphasis on what genotype that you do carry. So, but surprisingly, a lot of adults don't still know.
Really?
Yeah. But they often get contacted by the medical team, the CF team, if they've got the right genotype to help them with their child. But, yeah.
Just in addition to that, like from my point of view, I'll just go into like my family. As soon as my son was born, I'd let my family know that CF was in the family. So they had an opportunity to get their kids tested. Now, you can't get your kids tested until they can legally consent to it till the age of 18. So they're not going to know whether they're carriers, but their signs, if they were CF, then it would have shown up somewhere. But yeah, you can, while you're pregnant, you can get tested to see whether it's a carrier or non-carrier or whether it's got CF. But once it's born, the child has to consent, but they have to be about 18.
Oh, so when I was pregnant, we had River's father tested, because if he'd been a carrier, then we would have had, 25% chance of having a child with CF. So then I would have had to choose, am I going to abort, am I going to keep this baby, what am I going to do? He came back as a non-carrier, so with our information we had 18 years ago, there was no way she could have CF. But actually, now we know about all these genotypes that they didn't use to test. So last year, they actually wanted to test River. The doctor suggested it. She didn't have CF.
So she's
Good.
good to be a carrier now.
She's absolutely a carrier because she has to take
Oh, sorry.
something
Yeah.
from me, and I'm obsessed
And
with
you get to
the X's
yeah.
in the box. Yeah, so she'll have to think about that. You know, what she wants to do, whether she wants to get her partners tested, whether she would want to have kids with CF, whether she wouldn't. You know.
Would you really want her to get her partner to be tested? Would you say it would be not the best, like, after how you've been brought up and how your CF is, would you sort of be disheartened if she didn't get tested and then it found out it was a CF baby, or would you be like, it should still be fine because it's, obviously you're going to love the baby and everything, but
Yeah,
now you've
no, I
got the
would
burden
totally-
of CF,
I would totally suggest that.
she should get checked.
She
like
should
the
get it
partner
checked.
or something should. So
Absolutely. And then then you'd have discussions about what you
Because you know
weigh up.
there's the point that you can abort
Yeah,
if you find out your baby's got CF.
yeah.
Would you advocate for your
What
daughter?
would I advocate?
For your daughter, if you found out she
Yeah,
goes, she has
Yeah,
a,
Rick
she
and I
has a
used to
CF
talk
baby,
about this.
would you say, after my experience, I would not want to have to them, or would you say?
No, I would never say that. No, I'd
No.
never say that. No, I'd never say terminate based on that. I mean, no, I wouldn't say that. And she would be very well placed to actually understand,
She does seem to have a very
you know, what she was taking on. I remember her saying, you talked about this, and she was going, yeah, I would have a kid with CF, but she goes, you'd be a shit babysitter because you'd just be all like, no, cross-infection. Funny. But, no, I remember actually, but yeah, no, I wouldn't be advocating terminate, no. Because that just feels too weird. It's almost like
I was just
advocating my own
surprised.
termination.
I was surprised when I
Right,
heard that you can abort CF. I don't know.
No, it's a great question, and it's things I already do talk about with my kid, absolutely. I think for me it's all about knowledge, choice. So I'd be all about finding out, and then choosing.
She could look at getting IVF as well, so that she can
Yeah.
see that
Yeah.
before it even came to that.
Yeah. There's a bit of a, we really need to have a perfect society anyway. But then, of course, I'd want to be saving my daughter from pain and trauma, but
Yeah.
I like to think I haven't only caused pain and trauma to my parents. Yeah.
Are you the only family member with CF?
Yeah, I am, yeah.
And how did your parents cope?
I think back in the 70s, it would have been a very challenging time because survival rates were so low, so little was known. I think it would have been very hard. I actually found out on my second birthday, which I was trying to put myself in their shoes about how sad that would have been.
How did they find out? What kind of led to that?
I just wasn't putting on any weight, you know, that failure to thrive, just constantly fatty, pooey nappies. Yeah, but I think there was quite...
Imagine the nappies they had to change.
Yeah. Sorry?
Nappies are the worst at times.
I don't know if they even kind of knew enough about, even knew that really back then. But I remember asking my mum about it. She said a few times she'd say to the doctor, something's wrong, and they'd be like, no, just put her on a bottle. No, just something different. And they finally got tested. They talk about it as being very, very sad. They were following a religion at the time which didn't believe in medicine. And there's controversy about whether they didn't treat me for 2 weeks or 1 year. But different parents tell me different things. So there was that went on. When I was growing up, they were really good. It was out of bed physio. You know, they did my physio morning and night. There was, they were really, they put a lot of time in when I was a kid. I think there was a lot of, just was almost no attention was given to it. I don't remember a single family conversation about CF, ever. And I don't remember ever being told I had CF. And in a way, as I remember saying last year, I think that set me up quite well as a kid, but then to not really be talking about it or focusing about it. But then I felt that through my teens and my adulthood, that denial, for want of a better word, really kind of let me down. It's actually I needed to know more, and I needed to be learning young. I shouldn't be drinking, and none of that. I didn't know anything. When I first went to hospital, I didn't even really know you could go to hospital, because I didn't go to hospital until I was 18. I was so out of the CF system. I'd never even been to PMH. I was seeing a doctor that worked at PMH but in private clinics, so I was really protected, which was the goal, but in some ways isolated as well. So, and why that might have been good as a kid, I think then I just didn't really know. Like suddenly I was in Melbourne by myself, 18, coughing up all this blood, going to hospital, didn't even know about hospital almost.
So if you were seeing someone in private practice, did you see a dietitian? Did they have...
No, so I wouldn't see a dietitian, I didn't see a physio, no. I just went to PMH for flu shots when I used to kick the nurses, get in trouble. Yeah. And even, and I saw that paediatrician right through till after I was pregnant. So, and I had my child and everything, and then it was like, you should really transition over to the adult centre. So I came over here when I was like 24 going, what? saw these people. I had gone to a couple of CF camps actually, which was a reliant on. But so when I say that I've had no talks about sexuality or any of that, that might have been happening at PMH. Maybe, you know, it just, I wasn't exposed to any of them. Maybe it's expected that you know it by the time you're an adult. But things change. You should still have these conversations. You guys should still have these conversations.
Have you come across people of blended families where parents have split up and one's got a CF child and then somebody else, like they meet a new partner, they have children?
I don't personally know anyone like that. Yeah, is that your situation? Yeah. Yeah. Sorry. Oh, it's fine. It's really hard. Blended families, I've lived in a blended family. Step parenting and everything and all that, but the best of times is really challenging. And then
It's not hard, it's just lack of knowledge.
yeah.
Not being exposed to it.
Yeah. Yeah. Lack of knowledge is one of your biggest barriers, isn't it? To everything. Empathy, moving forward. Do you want to tell us more about your situation?
Pretty good, actually.
Yeah. You've got a kid with CF or your partner
My
does?
partner has, he's
Yeah.
17.
Your partner's a kid, yeah. Sorry.
That would
It's clarifying. Yeah.
I like younger men, but not that young.
To be young.
No, his son is 17.
Yeah.
And I've never been exposed to anybody with CF.
Yeah.
So I knew about it,
Yeah.
but I didn't know what was involved.
Yeah.
And like we all get on really well. There's never
Yeah.
ever been any conflict or
Yeah.
anything, but it's only been very new.
Yeah.
So I'm still learning.
Yeah. There's a lot to learn.
And I sometimes think that they're not telling me everything.
Yeah, like protecting you.
I don't think so, because I'm a nurse and
Yeah.
my partner's, she's a nurse, you know, and she'll be alright, like,
Yeah.
she can help out and she understands
Yeah.
and stuff. But I think my stepson is kind of, he's open about stuff, but I think because they've managed themselves for
Yeah.
so long,
Yeah.
that it's kind of like they don't want to, I don't know what it is, kind of like, yeah, we got to go trip up to to Princess Margaret, and he's got to have a tune up, and he's got to have all these things, and he's on the drug trial as well,
Yeah.
and so it's kind of like, yeah, Dad and Toby all the time.
Yeah.
Dad and Toby, Dad and Toby.
Yeah.
So I kind of feel a little bit out of the loop sometimes.
Yeah. Sure.
So, and I want to learn more. I want to understand
Yeah.
what his future's going to be like.
Well, you should take my phone number and my email and we should talk. Okay? Yeah. I would love to help.
Well, after this
Welcome.
week, you possibly know actually more than Toby and...
Yeah, you're the wizard. You're the CF wizard in the family now.
Yeah, there's a few things they're going to be convinced of changing.
I must
But
admit that
there is that expectation that you are a nurse, you know this stuff, and we don't.
As I say, seems very
Yeah.
And we don't see kids in hospital or
Yeah.
adults in hospital with CF.
Yeah.
Very, very rarely in the country, never in an acute
Yeah.
setting.
That's why these things are so good, aren't they?
Everyone's experience is so different. I mean, you've got obviously some core stuff, which is the same.
Yeah. But totally, I'm not talking about, the CF experience. I should add that as a disclaimer. It's just me and my baggage and my world.
Yeah.
I've got some friends who've got a older daughter who's got spina bifida in the wheelchair, and then so the mum, and it's a different father in New Zealand, and they've got them together, and they've got a couple of young kids, and it's beautiful how they manage. It's really nice.
When we all get on really well as a family, which has been amazing and I feel really lucky that we've got on well right from the beginning.
Yes. These guys at CF, WA would have so much.
It hasn't got to be like this.